Karissa Brabant. I am one of the family physicians that works in Moose Jaw at Circle Medical Center, and I work very closely with Square One to provide primary medical care for people that are involved in their program. I am here today to speak about the benefits of Square One and what I have seen working on the front lines and working with these people directly, and the improvements in health that I have seen in that collaboration with Square One. Now, normally I would be at this event in person, but unfortunately I am at a conference in Saskatoon, so I won't be able to be there in person, but you will see me at future events. So I first started working with Square One roughly a year ago, when they approached me to ask if I would be able to help them provide primary care for the people that are involved in their program. And they explained that they were going to start doing ground level work, casework, direct work with people to help from a supportive housing perspective and to help provide people with resources and actionable items, like very goal-directed work to help people get housing support and to be safe early in their journey and then help them throughout a long period of time to gain independence. And I said, absolutely, I would love to be involved in this program. What I noticed very early in working with Square One is that people would come see me and there would be a lot of hesitancy or unsureness and just a lot of fear associated with accessing the medical system, which does come from a place of trauma and of trauma or previous negative experiences. And so when patients first come to see me, it's really about developing that trust first and developing that relationship with them so that we can actually develop a good therapeutic understanding of what is needed. And patients come in from a lot of different walks of life. There could be people who are dealing with homelessness for a long period of time. It could be a shorter period of time. It could be associated with substance use. A lot of the time, it's not associated with substance use, with very high intensity medical conditions that need care. And one thing that I've noticed in working with Square One is that all of those barriers that used to get in the way of my patients actually implementing the care and implementing the recommendations that I had for them are being broken down. With the assistance of Square One, having the roof over the head takes over a huge amount of stress off of the patient's uh, overall list of things that they are needing to worry about. It's very easy to let your diabetes go untreated, to let infections go untreated, and to let your mental health go untreated when you don't have the basic necessities of life. And so having Square One be involved means that everything that this patient is dealing with socially is not something that is going to get in the way of their care anymore. Square One, also with patient consent, is involved in the visits so that we are actually able to work directly with Square One on the medical standpoint, so that if a patient needs an MRI, they need an X-ray, they need lab work, they need ultrasound, they are able to help facilitate transport to that appointment, as well as booking and follow-up so that I can see them for their results. I've noticed in working with Square One that patients who previously might frequently not show up to their appointments for whatever reasons they can't make their appointments, we are actually seeing them in clinic, we are seeing them in follow-up, and we are seeing the improvements in their health over time. We're seeing better diabetes control, we're seeing better control of infections, we are seeing better control of substance use, and we are seeing patients actually care about their health and care about the things that they had previously been putting on the back burner for so long because those social issues had not been dealt with. And so in working with Square One, I can definitely see the improvement in patients' health. And I'll be honest with you, there's an improvement in my quality of life as well as a physician because I can't fix those social issues. That is not something that I have control over. It's not something that I am able to directly be involved in. And so when I have a patient that is working with Square One, I know that they have those social elements being dealt with, and I can help deal with the medical elements. So that patient is being assisted and helped in multiple areas. That is not, as a result, there's like not an area that is just being missed and ignored. Um, and so it's been an absolute honor and a thrill and like just an absolute delight to work with Square One because all of these complicated medical things I can actually deal with. And I know that the patient will have the follow-up and the support that they need to actually deal with these medical issues. And then we can improve patient education and patient knowledge and understanding of their medical issues as part of their journey in working with Square One. Their journey to independence also includes independence in their medical issues. Being able to handle their diabetes long term, being able to handle their high blood pressure long term, signs and symptoms to watch out for if they know that things are going in the wrong direction. So all of these things make my job so much easier so that I can actually provide like high level quality care for very complex needs. And so I have noticed the supportive housing initiative has been just a huge benefit to helping these patients, not just with their housing, but with their medical care. Um, the last thing I will say about it is that with supportive housing in place, it also does reduce calls to EMS and reduces visits to the emergency room. These patients have a place that they can come to that is not the urgent care center and not the emergency room, and I can help manage their conditions at my clinic. And that has allowed us to also reduce use of those acute care services for these very complex patients. And so those are the benefits that we're seeing kind of within our very own city within Moose Jaw.
That's incredible. And so from us to you, it's nothing but gratitude that
Hmm.
you have a heart and an intention to support the folks that we're serving. And
Yep.
so we cannot thank you enough for that and for advocating on our behalf, not only with the, in our community, but beyond provincially. I know you've been using your voice, and we're
Hmm.
so grateful
Yeah,
for that. So
absolutely.
thank
Yeah,
you.
you
Thank you.
are
Thank
welcome.
you.
Yep. I am just thrilled with the quality of work that Square One does too, because like works with Square One is just super non-judgmental. There's no like faulting of the patient. Like it's just this is the situation that this person is in right now. This is their supports that they've told us that they need, and we are going to work with them to help them gain independence to get those supports in place and to learn how to do this on their own over time. And there's no like judgment at any point of this. And that is the type of people that I really like to work with that are willing to meet the patient where they're at and what does this person need at this moment. Because honestly, in my practice and with the type of work that I do with a lot of vulnerable populations, what does this person need from me right now? And then how can we build that relationship and build that trust to improve health over time? And I see the exact same mentality in Square One.
I love it.
Yeah,
Thank you. Oh my gosh. Thank you so much, Dr. Brabant.
absolutely.
We're so
Absolutely.
grateful. And
Yeah.
thank you for taking the time to speak to our community in this way so they can learn and
Mhm.
understand. We appreciate you deeply.
Absolutely. I'm very happy to help.